where you're from in the chat box, and we will, we're glad to meet everyone and from everywhere across the globe. Okay, so let's get started. We are recording this meeting, so just letting everybody know it's being recorded, and then it'll be posted to our YouTube later on. All right. So just to give you a brief introduction, I'll briefly introduce myself and then I'll hand it over to Dr. Bendikson. But I am Hina Ahmed. I am the VP of Clinical Operations and a physician assistant at Kindbody. I'm out of the New York City office. So if you're ever in New York, you might see me for an assessment or in the hallways. I'll make sure to say hello. As a physician assistant, I do see patients for their initial assessments and any additional testing and things that they need. And we have REI physicians, which Dr. Bendikson is an REI physician who we work very closely with. So I'm going to pass it along to her to give a quick little intro. Oh, you're muted again.
There we go. All right, Hina, thank you so much. So like Hina said, I'm one of the reproductive endocrinologists, which is just a fancy word for fertility specialists. So I work out of the Los Angeles office, and we actually have two offices in LA, one in Century City and one in Santa Monica. So I work at both of them. And I actually also work very closely with Hina because I'm the director of clinical development. So I hold two little hats in this wonderful organization of ours.
Awesome. So I want to talk to you a little bit about Kindbody before we start to talk more about the AHT testing. Kindbody is an organization that we started about 4 years ago, and it's been our mission since the beginning to bring reproductive health and fertility care to all people and make it more accessible. We serve patients directly, either as a direct patient in our clinics, which we have clinics in multiple cities, including New York and Los Angeles, San Francisco. On our website, we have all of our wonderful cities listed. And we also work with employers to provide fertility benefits. So if that's something that your employer is not offering you right now, please talk to them, because all employers should offer fertility benefits to their employees. And Kindbody is a good resource if you have any questions about that. What we do, so we do a number of different things aside from just fertility, but we do fertility. And within fertility, we see patients for assessments. We do see patients virtually, everything under the fertility umbrella: egg freezing, embryo freezing, IUI and IVF, donor services and third-party services, LGBTQ, genetic testing, and now, happy to announce, we also have at-home fertility testing. Along with that, we also provide gynecological services and wellness services. And so under gynecology, we can do everything from well women's checkups. You can come in for an urgent GYN if you need contraception or a pap smear. And we also deal with PCOS, endometriosis, fibroids, preconception under gynecology. And in our other survey of services, we provide counseling and support for donor and surrogacy, LGBTQ services, wellness and nutrition, which includes therapy and nutrition consultations. And we also deal with mental health. And we, as a company, want to treat the whole person and not just fertility. And this is why we offer this whole array of services for all of our patients. We are on a mission to change the way that women's healthcare is delivered and healthcare in general is delivered. Fertility and reproductive care is an essential service. You know, during COVID, one of the first things that had happened is everyone said all essential services are the only things that can stay open and everything else has to close down. And unfortunately, one of those things that they had closed down was our fertility services. But it was very, very, very quickly turned around because everyone realized how important and imperative it is to talk about reproductive health, to provide reproductive health and provide the care for fertility and for conception, because, you know, there are many things that often are important in fertility care that can't be put off, and we can't delay them because of, you know, even a pandemic. So that's why it was really important that we as a company also stood behind this mission that fertility care and reproductive care is extremely essential. So we want to talk a little bit about fertility today, but we also want to talk about why it matters. And the reason that it matters is because all our lives we've been taught how not to get pregnant. From the moment we're in grade school and in high school, and that's all you talk about in health class is how not to get pregnant. But when it's time to get pregnant, there's not a lot of questions about how and when and what and where that nobody seems to be answering for anyone. And we want to be the ones to answer these questions for not only our patients, but for the community in general. And this is why we're doing this talk today. So what do you need to know about fertility? What we need to know about fertility is that the most important thing, and it's unfortunate, but I have to say it, is that age does matter. And that's the most important thing when you think about fertility, because fertility starts to decline as we get older. Unfortunately, as women, our fertility declines a little bit faster than the fertility of men. And that's why it's really important, if you have female reproductive organs, that you understand that what is the attrition that occurs with your eggs as you are progressing through your lifespan. So let's go back to the basics. I'm going to give you a quick little biology lesson. The last time you heard this might have been in health class, in biology, I don't know, but I'm going to tell you again. So unfortunately, when we are born and we have ovaries, we're born with about 2 million eggs. And as we progress in our lifetime, we have attrition of these eggs. The unfortunate thing is, by the time we reach puberty and we have our first period, we've lost many eggs to that point, because there's eggs that are coming out of storage every single month. And when we're before puberty, we're not doing anything with those eggs. They're just coming out of storage and they're being wasted. And we lose about 300 to 400,000 eggs by the time we reach puberty. That's a tremendous amount of eggs that are being lost. Sorry, we're actually down to that many number of eggs. Not that we've lost that many, we've lost much more than that. So we're down to 300 to 400,000 eggs. From there, whether you're on birth control pills or not, whether you have irregular cycles or not, it doesn't matter. We're losing about 1,000 eggs every single month. And as we get older, we start losing more and more eggs. And what ends up happening is we actually deplete what's called our ovarian reserve. Our ovarian reserve is the number of eggs in our reserve overall, and that begins to deplete over time. And we're going to talk a little bit about that. And Dr. Bendikson is going to get into that when she talks about just in general infertility. So let's talk about age once again. So now we're going through this, in our lifetime where we're shedding a lot of eggs, or shedding about 1,000 eggs a month, we start to reach the age of 35. There's two things that typically happen at the age of 35. Our ovarian reserve starts to decline, because now we've lost so many eggs up until the age of 35. And the other thing that starts to happen is that we also, the genetics of our eggs also becomes a little bit weaker. I like to think of egg cells, right? Think of them as your skin cells or your hair cells. And as you get older, the genetic makeup of those eggs gets weaker, just like the genetic makeup of our skin gets weaker, our hair gets weaker, we start to get wrinkles. It's kind of the same idea, but eggs are really, really delicate. And so they start to age much faster than that. And so as we age, our eggs age with us. 1 out of 10 women experience low ovarian reserve or premature ovarian reserve under the age of 35. And that's why it's really important that we have these talks about fertility early, because one of the things as a society we're starting to do is to delay pregnancy. And not that there's anything wrong with that, but we need to be then empowered to know what happens when you do delay pregnancy. And we're going to talk a little bit about that going forward, and why it's so important. This at-home testing is really a game changer, because it will give you the ability to find information out quickly and easily, so easy, and be able to act upon that information if you need to. So we talked a little bit about the decline in the quantity of eggs in your ovarian reserve going down over time. And I also talked to you about the quality. So both of these things matter as we get older and as our fertility starts to decline. Poor egg quality can result in the risk of miscarriages or passing on a genetic abnormality to your child. Things like Down syndrome and trisomies, they all are because of an issue with the genetic quality of the egg. And so it's important to understand that and why age is a part of that. The reality is, you're never too young or too old to learn about your fertility. The truth of the matter is, today is the perfect day for you to learn about your fertility because you are the youngest you will ever be. Tomorrow you'll be a little bit older. So be proactive about your fertility and really take it into your own hands. Empower yourself to learn and have the tools that you need to make decisions about your future and your future conception. So how can we do that? In a very, very easy way. And that is by ordering one of our tests, a kind at home fertility test. I'm going to go over what's in the test and what we're testing for, but we do have two types of testing that are available. One is a female hormone blood test. And we'll go over what is encompassed in that, but it includes some hormones that are important to learn about your fertility, but also some hormones that are important for conception. And so we'll talk about that. There's also a male panel that we have, which is in the same way, tells a little bit about your fertility and also some things that are important for conception and being in the best health for conception. The tests are available on our website. If you go to shop.kindbody.com, so easy. You just go there to our retail shop and you can just, by the click of a button, order the kit. It can't get any easier than that. And you can do this right from the comfort of your home. There's not many things we can do from the comfort of our home, but this is one of them. So we're going to talk a little bit about the kind at home test, and I'm going to show you the components. I'm going to show you how to take it. This is a wonderful little layout of everything that you're going to find in your box. If you see on the right-hand side, we have a nice little instruction card that goes through everything step by step. You have these two little lancets and some other prep materials that are there, some alcohol swabs, a card that you're going to fill out with your information, and some other things. And this is a nice little layout of all of that as well. You get a collection card. You're going to get two lancets. There's going to be alcohol pads already in the box for you. You're going to get some gauze if you need it. You have a little card that you're going to fill out that's going to go over your information and some mandates. So very easy. You are going to do 4 easy steps: prep, drip, poke, and ship. That's all you need to know. So to prep, you want to register your kit. There's a little card that will come inside of the kit where you can write your name, your date of birth, and that's the card that's also where you're going to collect your blood specimen, okay? The way that you do that is you take the lancet and you poke your finger, and the best thing to do is to poke the side of your finger because you'll get much more blood than if you go straight on. So if you can see where I'm pointing, the side of your finger, and then you want to squeeze the blood out onto the card. It is very important that you fill the whole well. You'll see the whole square that is on the card. You're supposed to fill the whole card with blood. So you might have to drip, and squeeze a couple of times before you get enough blood on the card. If you don't have enough blood on the card, sometimes the test can get rejected. So you want to make sure you take that extra time and you squeeze enough blood onto the card. Once the card, you've squeezed the blood onto the card, you want to wait about a minute. It dries up the blood, and then you're going to stick it in the return envelope and send it back to Kindbody, and we're going to process it for you. The things that we're testing are 7 different fertility related tests: an AMH, a TSH, an FSH, free T4 is what we call it, prolactin, LH, and estradiol. And why are these tests important? AMH helps to estimate the number of follicles in the ovary, which helps estimate the number of eggs that are released. And so one of the things that we're going to talk about a little bit later in the talk as well is why AMH is important, but it does tell us about your ovarian reserve. It gives us an estimation of how many eggs we would expect to see if we were to do an ultrasound and do what we call an antral follicle count, which we'll go into a little bit later, but it gives us an idea of how many eggs are in your reserve. FSH is also another important hormone. It's responsible for growing follicles and for starting the ovulation process in your body. And so FSH should be at a certain level at the beginning of your your cycle. And that's why we're going to be testing your FSH to make sure that it is where it needs to be. Along with that are two other hormones that go along with the FSH, which is your estradiol and your LH. And these two help to regulate your ovulation. Prolactin is a hormone that can also affect the way that FSH acts. And so that's why it's important for us to check whether it's normal and if it's impacting your ovulation. And then the two other hormones that are important that can affect the way that you're ovulating, but also affect your fertility. And then when you're getting pregnant, is really important for conception is the TSH and the free thyroxine, which is known as free T4. And these are two tests that are important also in pregnancy. So that's what we'll be testing on the female kit. And then go to the next slide. We'll talk about the male fertility test. So the male fertility test has similar testing. And you would think, the only thing that's not on here is the AMH because the AMH comes from ovaries, but FSH is a hormone that pulsates from the brain, but also helps with sperm production. So we do check FSH, and along with FSH, you're checking estradiol to check their levels to see how it is affecting, the sperm production. Testosterone, obviously very important for males because that also directly affects sperm production. We look at prolactin because prolactin can affect FSH and estradiol levels and testosterone levels. So we're looking at that, and the thyroid hormones, TSH and free thyroxine, which is also really important for fertility and can affect these other hormones. So we want to know how these hormones are affecting each other. And that's why these have been selected to be on this kit, as well as the female kit. So at-home tests are a great way to get started. It's literally a first step. The AMH is a first step to learning about your fertility, and the FSH is a first step to learning about your fertility. So when you get your lab results back, we're going to be able to measure those first steps and give you some personalized recommendations about where you should go from there. If some of these tests are abnormal, you may want to set up a follow-up appointment with a Kindbody specialist. If you're even just curious about everything looks normal, but I'm curious, I want to know, I want some more information. I want to know, is it a good time to get pregnant or not? I want to know whether I should delay pregnancy. And is that okay? Is there some issue with my sperm? Should I do some further testing on sperm? And there are additional tests that need to be done. Schedule an assessment appointment. We will talk you through all of it and go over everything with you. And then when you're ready in time, if there is something that you'd like to do further, if you are having trouble conceiving in the future, or you want to freeze your eggs, you're thinking about fertility preservation, then we can help you on that path as well. It's like a one-stop shop for everything that you need, starting from just getting some basic information. So from that point forward, there are many steps that actually also happen is when you schedule a fertility assessment with Kindbody, and Dr. Bendikson is going to go into those next steps with you.
Hina, thank you so much. I'm super excited to kind of walk everyone through the next steps of what will happen, whether you've had the at-home testing or you want to directly come into Kindbody and speak with a provider. So if you decide to make an appointment with a Kindbody fertility specialist, you can see us both virtually and the clinic. So again, if you don't want to leave your couch, you don't have to leave your couch. You can still see us. You don't need to come in. What is included in any assessment with a fertility provider, if you are a female at birth, then that is a vaginal ultrasound. And with that type of assessment, what we're going to do is count the number of follicles that you have in your ovaries. A follicle is just a fluid-filled sac with an egg in it. I always like to think of it as every little egg is has its own wrapper, right? And that wrapper is the follicle. And so what we're doing when we're measuring the follicle count, right, is we're just assessing the number of eggs that the ovary is recruiting this month. So each month you have a bunch of eggs, as Hina's already talked about, you have a bunch of eggs in your ovaries, and each month your ovaries recruit a group of those eggs to start to develop and grow. And so that is what we're going to be assessing with this ultrasound. And then if you've had the at-home testing, we don't need to do fertility tests because you've already had them. And so we can actually review those hormones at your assessment. If you just decided to come into Kindbody and you haven't done the at-home testing, that's no problem. We can actually do the same hormone tests in our office. And so you can just get all those hormone tests, including the AMH, in our office. Once you have that information, you're going to be able to talk to the provider about what your next steps might be. It's possible that your next step is to do nothing and just to follow up with us in 6 months and a year, but it's also possible that you might want to undergo a treatment. And so the treatments that we have available are egg freezing, embryo freezing, or fertility treatments for those couples that are trying, and individuals who are trying to get pregnant and are potentially encountering roadblocks or having issues. And those can include something what we call IUI, which stands for intrauterine insemination, or IVF, which is in vitro fertilization. So let's talk about egg freezing first. So what on earth is egg freezing and how does it work? Well, the most amazing thing about the female body is that the uterus doesn't age, right? But the eggs do. So if we can go in, take eggs out of a woman, freeze them, right? And then 10 years may go by. She was 30 when she froze her eggs and she's now 40. Her uterus is perfectly capable at 40 to carry that pregnancy. And so we can take those eggs out if she wants to use those eggs, thaw them out, and then her chances of getting pregnant are of her 30-year-old self, even though her uterus is 40. So we are literally pressing pause by taking those eggs out and freezing them for you. So there's a lot of things that you should consider when you're thinking about egg freezing, but it really starts with 4 basic questions. The very first question is, how old are you right now? The second thing you need to ask yourself is, how many kids would you ideally have in your family? When you start trying is very much going to be dependent on maybe if you only want 1 child or you want 5, right? So then you have to start thinking about, okay, well, how old do I want to be when I have my first child? And then how old do I want to be when I have my last child? Again, the number of children, how old you want to be when you have your first child and last child, all of those things are going to play into what you decide to do about when you want to start your family. So let's go back a little bit to the biology, because I think that's super important to understand how egg freezing and IVF treatments work. So I talked a little bit about when you come into the office, and if you're a female, you have that vaginal ultrasound, and we're counting the number of follicles that we see in the ovary. So we're counting the number of eggs, essentially, that your ovary is allowing to grow each month, right? Well, in your natural body, your brain does not want you to have 8 babies at one time. It wants you to have 1 baby at a time. So what it does is it secretes a small amount of this hormone that happens to be FSH and LH. And those hormones are going to tell the ovary to make an egg and let that egg, of the ones that are growing and are recruited, which ones are actually make one that's going to grow. Now, the thing is that it secretes just a small amount of hormone only for 1 egg to grow, but you have all of those other eggs in that group. So what's really important to know is that all of the other eggs in that group, they die, which is really sad. And I always hate to say that, but they do. It happens every single month. You don't even know it's happening, but all of those eggs are going to die. And so you lose that whole group of eggs no matter what. You have 1 egg that ovulates, you may not get pregnant from it, right? And then the rest of the eggs are going to die. If you are on birth control pills, this process is not stopping. You still have a group of eggs that are growing. And then because there's no hormone around, because you're on birth control, then that whole group of eggs dies, right? So with egg freezing, what we're doing is we're just trying to capitalize on the fact that there's this group of eggs there. And then we're going to try to take them out of you and save them for you for the future. Now, remember, you were going to lose these eggs anyway. So by taking your eggs out and freezing them, we're not impacting your ability to get pregnant in the future at all. We're not going to change. I mean, in a negative way, we're not going to change. And of course, we're going to positively influence your ability to get pregnant because we're going to save those eggs from you. I always like to think of it as, you have like some soil in the ground and there's a bunch of seeds there, and you may plant 10 seeds every season. And normally you might just want 1 flower. So you're going to put a little bit of water and 1 seed, and that 1 beautiful flower is going to grow. All we're going to do is we're going to fill up your water bucket a little bit more And then we're going to put it on all of the seeds. So you can have like a whole garden of flowers growing. All right. So that's essentially kind of the basics of how it works. So during the hormone itself, what we're going to, during the cycle itself, we're going to give you those hormones, and that's hopefully going to make as many of those eggs as possible grow. They won't all grow, right? But as many as possible. And then before you're going to ovulate and release those eggs on your own, we can go in and take them out of you. So we can get a whole bunch of eggs, freeze them all at one time, all right? And so you can have those eggs and save them for yourself for the future. So the way the cycle works is that, unfortunately, at this point in time, the medications, the hormones that you're going to take are not oral. So they're injections. And remember, we're just giving you FSH and LH. Those same hormones that I told you, like, are the ones that allow one egg to grow that your brain is secreting. We're just going to give you a bunch of them. So it's just a synthetic form. But you do have to do an injection, but it's a tiny injection. It's a little injection. It's called subcutaneous because it goes right underneath the skin. You can do it in your stomach. You can do it in your thigh. And you take those injections nightly for about 10 days. And that's going to help those eggs, as many as possible in that group, we're going to help them grow. We're going to have to monitor you during this process. All right. So you will have a couple of appointments during this time so that we can do ultrasounds and blood work to assess how you're responding to the medication and when is the appropriate time for us to take the eggs out. Don't worry about the injections. We will absolutely walk you through every single step of both getting the medication and how to do them. You can see Hina is in this lovely video where she is actually going to teach you how to do those medications. And we have nurses on site in the clinics who can also take you through the little step-by-steps. We want to make sure that we know this process can be sometimes a little bit nerve-wracking. You're maybe not used to dealing with needles at home. We want to make sure that this process is as easy as possible. So here's a sample kind of layout of a calendar of how long the cycle takes. And I love this because it really just shows you how short it actually is. I think that, I don't know, even like 20 years ago, we were giving people injections for about 3 to 4 weeks in order to do these types of cycles. Now it's much, much shorter. We figured out better ways to do it that are easier for patients. And that's truly important. So you can see if you look at this calendar, right? So this patient's going to start her medications on a Friday, right? You can see that in that second row. And then she'll have her monitoring visits. She might have 3 or 4, depending on how quickly her eggs are growing. And then her retrieval is going to be somewhere between Monday and Wednesday of that following week. Sometimes it goes a little bit longer. Sometimes it's a little bit shorter. That's okay. It doesn't mean anything about the quality of your eggs, right? But the process itself is pretty short. Once the eggs are ready, then we're going to take them out in an egg, what we call an egg retrieval. You may have heard of your friends talk about something called an aspiration. Those are all the same things, all right? So the egg retrieval takes about 10 to 15 minutes. It's really quick. And you're not awake, all right? But you're just getting really light anesthesia through your IV. We always think of it as like twilight sleep. So you're just not going to remember anything. You're not going to have any pain. We're just going to quickly go in. We take a tiny little needle, and the ovary is actually sitting right behind the vaginal wall. So we can take a tiny needle to go through the vaginal wall, poke right into the ovary, and then we just take the needle and we push it into the follicle. And then literally myself or one of the other REIs we put our foot on a suction pedal, and that we literally watch that follicle disappear because that fluid's getting sucked into the needle. It goes through tubing and lands in a test tube. And so once we've drained one follicle, we just drain the next one, the next one, the next one. We drain all the follicles on the right side, all the follicles on the left. It's done really quickly. You are usually literally walking out of our office 45 minutes after the procedure, and you get to go home and just relax the rest of the day. So what's the difference between egg freezing and embryo freezing? We get this question all the time. So this is the point, once the eggs are out, that we determine what we're doing, right? If we are doing an egg freezing cycle, once the eggs are out, we are literally going to freeze them for you, and then you can use them at a later time. What's going to happen is we're going to have to take those eggs, thaw them out, fertilize them with sperm, and then that is creating what we call an embryo, right? Embryo freezing is just when you do the fertilization process first before you freeze. All right. So with an embryo freezing cycle, we take the eggs out at the time of the retrieval. That same day, we get a sample of the sperm, whether it is a partner or a donor, and we're going to take that sperm and we're going to fertilize the eggs, create the embryo, and then that embryo will be frozen. With our current technology, the success rates between egg freezing and embryo freezing are the same. So success rates are not what you are going to use to choose if you want to do egg freezing or embryo freezing. With egg freezing, the benefit to that is that you do not have to choose a sperm source right now. So if you are not with anyone, you have not found the right person, you get to just freeze your eggs and they belong to you. However, with eggs, they all look the same. So in terms of telling you what your chances of success are, we're going to use information like your age and how many eggs you have frozen to determine your chance of having a baby in the future. Once you take the eggs and you fertilize them and they become embryos, we start learning a little bit more information about it, right? I can tell you, all right, there's an 80% chance that your eggs are going to fertilize, but we don't know, are you going to be a little bit under that 80%, a little bit over, until we actually fertilize the eggs and then we create an embryo. So if you're freezing embryos, you will know exactly how many have fertilized. We can actually grow those embryos to a more advanced stage. And that stage, we can actually genetically test them if you want, all right, where we can tell, does this embryo have the correct number of chromosomes, which is really a big deal because it's a female's age that really determines if an embryo has the correct number of chromosomes in it. And if the embryo is chromosomally abnormal, meaning it doesn't have the right number, then that embryo is most likely not going to take. It could lead to a miscarriage, or it could lead, there are a few syndromes like Down syndrome that are the result of these chromosomal abnormalities. So if you are in a couple and you want to freeze embryos, and it's really important for you to get that information because maybe you would opt to do 2 or a third cycle based on if you know if the embryos are normal or not, then it makes sense to do embryo freezing. But there is not a right or a wrong. You're going to need to talk to your provider, understand your information, how many eggs that we think you're going to get out, how old you are, and you're going to make that decision with your provider of what is right for you. So what comes next? Well, your eggs are going to be stored at our Kindbody facilities, and we'll keep them as long as you want us to keep them. Right? There is no expiration date. People always ask, like, well, how good are the eggs good for? Well, hopefully forever, right? So we hope that you're going to get pregnant on your own and you're not going to need to use these eggs or embryos. But if you do need to use them, they are there for you. So what's IVF and how does that relate to egg freezing? All right, so IVF is just the second part of it. So when you hear about someone going through an IVF cycle, you're generally thinking about someone who has infertility. Well, they're going through that same stimulation process that you would do if you're going through egg freezing or embryo freezing. But once those eggs are out, then you are going to fertilize those eggs and get an embryo. And then you're going to grow those embryos out to that stage, that advanced stage that I was talking about. It happens to be called a blastocyst. And at that point, you can transfer the embryo in, or you can opt to test your embryo for chromosomal abnormalities and transfer them in once you know the results of that testing. There are lots of options for fertility treatments and lots of paths to parenthood, and they're not all IVF and egg freezing. Right? At Kindbody, for example, we offer the whole gamut of fertility treatment options. So there's something called an IUI, an intrauterine insemination. This is where the female is going to ovulate on her own. Sometimes she's ovulating just her one egg, her natural egg, and sometimes we're giving her some oral medications to make her ovulate too. And then after around the time that she's ovulating, we take a tiny little catheter and place sperm at the top of the uterus so it's much closer to the egg. That's an IUI or an insemination cycle, and that can be done with partner sperm or donor sperm. There's IVF that we talked about. IVF can be your own eggs or your partner's sperm, or it can be donor egg and donor sperm if needed. Sometimes we're just trying to help women ovulate. And so we're literally just, they're not ovulating on their own. So we just have to give them a medication to ovulate. We also do everything from egg donation, sperm donation, even gestational carrier. So we can do it all for you. So whether you're trying to get pregnant now or you're actively trying, maybe you're thinking about that in a few months, or maybe someday for you is like 10 years away, all right? It is never too early to learn about where your body is now, what's going to happen to your body in the next few years. So that's truly having a greater understanding of your fertility health. And this is the best time to do it, is now. And lastly, there really just is no perfect way that someone is going to go about having a family. And the path is going to be different for everyone. There's not a specific formula about how to do it. The most important information is that you understand where you are at now, what will happen to your body and your chance of having a baby over the next few years. So just learn where you stand. And that's really what we can do at Kindbody with both an assessment with a provider and our at-home fertility hormone testing kit. So we have a really great promotion. I know Hina had alluded to that in the beginning of our talk. So we have this great code, JAN22, JAN22 for January 2022. And if you use this code, you can actually get a 10% discount on our fertility hormone tests, right? And it's good through January 31st. And again, to get our Kind at Home fertility hormone tests, all you need to do is go to the website shop.kindbody.com and you can get and order your kits. And if you do it before the 31st, you can get 10% off. We also, if you use that same code, there are discounts on our assessment. So if you're doing a fertility assessment or a family building assessment, with that code JAN22, you can get $200 off or your insurance copay, right? And if you actually are doing a cycle, egg freezing, or IVF, or an IUI, you can get additional money off. With egg freezing or IVF, it's $500. With an IUI, it's $200. And that's with the same JAN22 code. And with that, you just need to schedule at kindbody.com/book-appointment. So I think with that, we were hoping if we have a little bit of time, which I think we do, to answer some questions that our lovely listeners have been asking in the chat.
Yeah, absolutely. Oh my goodness. You guys had me like a ninja in the chat. I was like, as you were coming through. But I think we got some really good questions, Dr. Bendikson. I'd love for you to talk about whether an IUD is going to affect the at-home testing. And just an IUD in general, I think that there's a lot of questions about that and whether, does it need to come out? Do we what happens with an IUD if I freeze my eggs? If you could talk a little bit about that, I think that would be great.
Of course. So it's important to remember with IUDs, some of them are hormonal IUDs and because they have progesterone in them, and other IUDs do not have hormones in them. And our data about IUDs and how it affects the fertility hormone testing that we have in our at-home kits, and also markers of ovarian reserve, are derived from the data that we know about oral contraceptive pills. So there are some studies with oral contraceptive pills that show if you have been on birth control pills for a long time, that your AMH levels and also the follicle count on that ultrasound can be a little bit lower, but it's just temporary. And if you stop your birth control pills, right, there was a really great study that was done at UCSF. What they found was that 60% of women had a 50% increase, all right, in their follicle count when they got off the birth control pills. But we don't always see that. So you don't always see the decrease. So it's not automatic, right? We don't have those specific studies that were done with oral contraceptive pills. They have not been replicated with other forms of hormonal contraception, like a Mirena IUD that has progesterone in it, like the Nexplanon implants. So we don't know, all right? So oftentimes, if everything looks really great, for example, if you've done your at-home testing and you have done an ultrasound and all of the markers look really good, we will not delay anything in terms of just proceeding with an egg freezing cycle. But it's important to, if for some reason you've done the at-home testing kits and you do see that maybe your AMH is a little bit lower than what you would ideally like, then I think it is important, if you are on hormonal contraception, to talk to a fertility specialist so they can talk through with you, well, how long have you been on hormonal contraception? Being on it for a month is probably not going to make a difference in your testing. You've been on it for 15 years. It's possible it might make it a little bit lower.
Great. Thank you. Thank you for answering that. And then there was a lot of questions about when is the right time to start like prenatal vitamins and, we're talking about the at-home testing, and prenatal vitamins is also one of the things that we have in our retail shop. So can you talk a little bit about that?
Sure. I always think there's never not a bad time to be on vitamins. Whether it's a multivitamin, there are so many vitamins that we are deficient in, especially vitamin D tends to be a very common one. Even here in LA, 2/3 of our patients are deficient of vitamin D. So there's never a bad time, right, to get on vitamin D and a multivitamin. Prenatal vitamins are just have a little bit extra, knowing that you will be pregnant and both supporting your own body and the growth of the pregnancy. And so that's why the prenatal vitamins just have a little bit of extra in there. Probably the most important vitamin in that whole prenatal vitamin or multivitamin is folic acid, right? Because that's the one that can actually prevent neural tube defects. So that's a spine defect in the baby. So we oftentimes have some patients that can't tolerate prenatal vitamins for one reason or another. And if they can't really take anything, I would say, we have really great vitamins at Kindbody, but for whatever reason, if that one or any other one is not working, taking the folic acid is most important. And kind of trying to get those things a little bit, get your body repleted and in all kind of vitamins a little bit before you're trying. So just so you know, the eggs are growing for a month or two before they actually ovulate. So anything you do in that period of time could potentially affect egg quality.
Great. Amazing. And let's talk I got a couple of questions about the male test. So I just want to, one of the good questions that was out there was that whether a vasectomy will affect the male hormone testing, or is it appropriate to go ahead and do the male at-home testing? And then the second part of that, or maybe an additional question in regards to the male testing, is there a preference to do the male testing first or a semen analysis first?
So with a vasectomy, it will not affect the hormone test. That's literally just a physical snip in the connection. So the sperm can't get out. So it will not affect any of the hormones. I think if you think about the hormone test and the semen analysis, they're both very similar in some ways, but they're different and they are looking at different things. So for example, what is so amazing about the at-home test that we have for men is that it does look at other things like your thyroid and testosterone that can affect your overall health, right? Can affect how you feel kind of sexually. And so your sexual health, your reproductive health, you're kind of looking at the whole picture with this at-home testing. And so for that reason, that's really important, right? And those hormones certainly can influence what the semen analysis looks like, but not directly and not always, all right? So I don't know, I wouldn't say that you have to get one versus the other. I think they're very complementary.
Amazing. Great. So Amanda Lynn hi Amanda Lynn. actually has one of the tests with her. So she wanted to show us on the camera. Can you go through?
I do. So I have one. I'm so excited. Mine just came. So I just went through it. Everything comes in a baggie. I dumped mine out so it's easier to show you guys what it all comes with. But the most important thing to remember is when you get your test is up here at the top. It's a registration code. So we have a link here that you'll go to and you'll want to register it. That's how we know the results are yours. That's how you'll get your results. That's how they will be in the Kindbody portal. So you can, when you go and meet with Dr. Bendikson or Hina, they have your results already in our portal for you. The test comes with some very, very handy instructions, a list of everything that's included in it, some detailed instructions, and a QR code here. So scan this with your phone. We're all familiar with QR codes now, 2 years into this. So scan the QR code. It's a beautiful video with Hina is featured. She walks you how to take the test and shows it to you. I'm not as brave as her, so I won't do that today. But you get your test. You'll clean your fingers, wash your hands. Here are the easy lancet. Twist this off, prick the side of your finger. The card that you'll drop the blood on. We'll make sure it fills up to the line. All the instructions are here. Comes with some Band-Aids and bandages. And then you will put the test into our shipping. This isn't the shipping label. What's it called? Into the transport pouch. Put into the transport pouch and then into the little shipping package here and ship it off. You'll want to wait just 1 hour for the drops to dry before you put it into the transport pouch, and then you'll ship it off and get your result in, a little over a week. So it's very quick, get it all very quickly. So it's a compact little test. If anyone in New York or LA has ever been to Sugarfish, that's what the box reminds me of. But you're gonna test your AMH. You're not getting sushi with it.
It does look like a Sugarfish box.
I don't know if it was intentional or not, but it's very chic.
Very, love it. Love it. So I think the chat's quiet down a little, but is there any other questions that anyone has? Would love to answer them.
I think I saw on there, Hina, someone asked about the dose of folic acid, and it's 400 micrograms. And it's really important. A lot of just regular multivitamins will have that in that. So if you're not sure when you're ready to start, and you don't want to commit to prenatal vitamins, like certainly a multivitamin that has that 400 micrograms is at least a baseline. But when you're really kind of serious, you should move into the prenatal vitamins. And there have been really important studies that look that like women who are taking prenatal vitamins have better success rates. So it is important to take them.
And we got a good question in the chat. So there are a couple of states where we can't ship the kits to at the moment. New Jersey happens to be one of them. New York is another one. And I think Rhode Island is the third one. We're working on this. We will get them to be available very soon. But someone asked specifically about New Jersey. We actually have a Kindbody clinic in New Jersey. So if you are interested in learning about your AMH and your hormone testing, please come in and see us. We're happy to do an in-house test for you. You'll have to just schedule a fertility assessment, but then that'll allow you to get all your information as well as a consultation about what that information means and next steps. So that's always a great thing when we have a clinic in a place for everyone to go. Not everyone's that lucky. Not everyone has a Kindbody. Yeah. I'm going to throw another question at you, Dr. Bendikson. So
okay.
Person in the chat said, I have heard eggs received from egg freezing may not survive the unfreezing process, or some can be abnormal or mosaic. These are a few concerns that has with egg freezing, especially because of the financial commitment. Do you have any recommendations or statistics? Because it's a very fearful journey, which we can understand. Sure. She actually has an appointment in a few weeks, so it'd be great.
That's so exciting.
Yes.
Well, that's wonderful. So yes, with egg freezing and with embryo freezing, when we thaw out that egg or embryo, it is not guaranteed that that egg or embryo will thaw. All right. The success rates with the thaw are incredibly high, though. And so that's really important to know. When you're thinking about egg freezing, we, for example, on the Kindbody portal, have a little calculator where you can go in and say, I am 39 and I have 10 eggs frozen. What is my chance of having a baby? Right. And this is not pregnancy. Like people get very fooled into like a pregnancy success rates. We are talking about you're not just pregnant, but you actually have a baby. That's called live birth. And so that's always important when you're looking at statistics. So we know that if you're this age, you have this many eggs, we can calculate out your chance of having a live birth. And this is from very good data that we've used to put our portal together. And this data, like the percent live birth, takes into account the fact that not all the eggs are going to survive, potentially, that not all of the eggs are going to fertilize. If they do fertilize and they become an embryo, not all of them are going to be chromosomally normal, right? So it takes all of those factors into account so that you should feel very assured that if you have 10 eggs frozen and you're of a certain a certain age, excuse me, that number that we're giving you is an accurate assessment of your chance of having a baby from those eggs. Now, the thing to remember is, right, someone who maybe only has a 5% chance of having a baby, she may have a baby from her eggs that are frozen. There may be a patient who has a 70% chance of having a baby from her eggs that are frozen. And when we thaw those eggs, she may not have a baby, right? Because there's a 30% chance it won't work. And so that is why we are very determined to make sure that all of our patients that are considering egg freezing or embryo freezing have this information, that we are very transparent at the outset about what the process is going to be like. There's a calculator that you can actually have, like on our portal, that will tell you how old you are. It will take your AMH into account and the number of follicles that we see on that ultrasound. That's that follicle count. And based on that, it's going to give you a range of what we think that you're going to get in terms of number of eggs retrieved. And it's a range because people respond to the medications differently. And there are so many things about the human body that are so nuanced, but you will have an idea, right? Once you start having the workup done and so having some of these tests done, of if you're going to go through an egg freezing cycle, how many you're going to have, and or if, you know, and then we can, if you're trying to think about embryos, we can kind of go through and calculate that out. And I was doing that earlier today with one of my patients and thinking about, okay, let's use this calculator, figure out number of eggs, and then we're going to go through and say, okay, we're going to do, you know, just put in like 80% fertilization and, you know, the percent that are going to grow to this advanced stage of the embryo, and kind of calculating out what we thought she was going to have in terms of number of embryos from one cycle, or at least what the range would be. And then using her age to predict, if you test the embryos, because the age is what's going to, the female age is what's going to predict how many of those embryos are going to be normal. And those are the ones you're going to want to transfer back. I did also see somewhere else in the chat too, an answer to another question of kind of, is it ever too late to start like a prenatal vitamin or a multivitamin? The answer is absolutely not. You know, even in those studies where it's shown that like you're taking a prenatal vitamin might decrease your chance of miscarriage, those numbers are so tiny and so small. But again, we're always kind of thinking about like whatever you can do to kind of help that process along is important. And so, no, it's never too late to start a prenatal vitamin or multivitamin. You could be starting your injections in an IVF cycle and start then.
Great. I think we'll take one more last question that just came through. And this is a good question. If you've been living an unhealthy lifestyle for years, can that affect your eggs? And so another question would be like, what are the things that would affect your eggs in your lifestyle? And would living a healthy lifestyle starting now for a few months help in prep in order to produce some good healthy eggs? So you can talk about that.
That's a great question. I have patients ask me that all the time. They're like, do I need to, you know, give up all alcohol, all caffeine, sleep better, meditate? Do I need to do that for a month before I freeze eggs? And the answer is probably no to a lot of those. Like, we know that like a small amount of caffeine, like having a big cup of coffee each day, is perfectly fine if you're trying to get pregnant. But we also know that there are toxic habits that people have, like smoking or vaping, that are really bad for eggs. And so if you find yourself in many ways having a very unhealthy lifestyle, then that might be something that you might want to eliminate and give yourself a little bit, just a tiny bit of a washout period. We're not talking an extended period of time, because if you wait too long before you're thinking about freezing eggs or trying to get pregnant, at some point the age becomes a much more important factor. And so you don't want to wait too long. So a little bit of a washout period, that's probably okay. There are other things, for example, like weight. When you have someone who is greatly overweight, that can both affect conception, so conception rates, and also increase the chance of miscarriage. That again, you have to take into consideration, well, how long is it going to take me to lose weight? How old am I, right? And if I take this long before I'm trying to lose a certain amount of weight before I'm going to try, at some point you might wait too long, and then actually there's more of a negative ramification for waiting. So this is why it's always really important to talk to a provider, so that you can kind of make those decisions with them of when it makes sense to like wait, and when it makes sense of like, okay, well, I'm drinking like 8 cups of coffee every day, but I can cut that back tomorrow. right? And so you can kind of jump right into getting pregnant because there's not like this longer lasting effect.
Yeah, I love that question. And I think that there's no time like the present to get healthy and also get your testing. So, you know, if any of you guys have learned anything or have heard anything from us today, is to be proactive about your fertility. Make sure that you are being healthy. Start from today. And one of the first steps that you can take is buying one of the Kind at home fertility tests to get tested for the basic testing that we need for our fertility. Schedule an appointment to follow up on these results. Go ahead and proactively schedule your fertility assessment, because once you do get the results, I'm sure you'll have some additional questions. You'll want to talk to us. Remember that the at-home testing is just a snapshot in your fertility picture. There are many other things that we have to look at, and those things can be all discussed when you have a fertility assessment, but it's a good starting point. And we want to empower you to start that journey with the at-home kit. Don't forget that we do have a promo code that you can use for the kit called JAN, JAN 22. And you can also use that code to schedule a fertility assessment. We were so excited to have you all with us today. All your questions were amazing. We love engaging with the community like this. So thank you for being here with us today. And let us know if you have any other further questions. I think Yasmin's on. If you can just drop it in the chat. navigator@kindbody.com is our main email address, and you can email us there. You can also just go to the website and chat in with us if you have any further questions.
Thank you. And Dr. Bendikson, Hina, thank you so much. We wouldn't do this without you guys. So thank you. And we appreciate all your hard work in getting this test out there. So hope to see you guys all in a Kindbody clinic soon. And if not, sharing yourself taking your test on social. So we want to see it. So thank you guys so much. We'll see you soon.
Yeah, tag Kindbody. Yep.
Yeah. Bye, guys.
Everyone.
Bye. Thanks so much for coming. Thanks for your questions. Thanks for your attention.